most important parts of learning and studying oncology is knowing about TNM classification. TNMG classification we'll talk about more later. Firstly, about T. T means tumor or primary effect. Different gradations are Tx. It's impossible to estimate a primary tumor. We don't know is a tumor present or not. T0. A primary tumor is not present. We know it definitely. T1. Primary tumor is present but less than 7 centimeters and it's limited by the kidney. It's one of the most important points. But it's graded into 2-1A and 2-1B according to the size, more than 4 centimeters or less than it. The next one is T2, a tumor more than 7 centimeters. Here you can see a kidney cancer. I suppose it's a T1 or B grade, about maybe 5 centimeters, and a mechanism of ablation. The next one, T3, a tumor not outside of fascia of Herold. You should remember about this structure from the course of anatomy. T3A, B, and C, according to the germinating to the different structures with not only in kidney. Firstly, it's an adrenal gland. You know that kidney is well connected with this gland and paranephric tissues. So this is T3A. T3B with tumor spreads to the vena ventrinalis. T3C when this tumor is large and it spreads already to the vena cava inferior. So the movement of metastasis in these cases is well spread and very dangerous one. And T4, the most dangerous stage, and tumor outside the fascia of Herold. You can imagine the size of this tumor. It may be more than 7 centimeters, even 10 and 15. There are different cases. Here you can see the cancer of kidney of the maybe upper part, about 8 centimeters in diameter. We can see why upper part, because this is a hilum of kidney and it is the ureter. Here you can see this operation was provided and the patient is alive and everything okay. TNM classification, the next one is N, regional lymph nodes. Nodes impossible to estimate, signs that it's NX. N0, it is in metastasis in regional lymphatic nodes. We should know that lymphatic nodes are so numerous. And here you can see this system of them near the vena cava and the kidney itself. N1 metastasis in one node, for example in this one or this one. And N2 and metastasis in many cases, many nodes, typical system of it. And here you can see Herod's fascia, its perinephral tissue, and other ones. M, metastasis, MX, again, it's impossible to estimate. M0, metastases are not present. M1, remote metastases are present. And here you can see a table which shows us different grades of tumors and according to their characteristics about firstly effect, nodes, and metastasis. If it's the fourth most dangerous situation, it's a fourth stage of T, appearing of affected lymph nodes and remote metastasis. Metastases can be different. They can outflow in our organism in hematogenous and lymphatic pathways. If at the first one, such organs as lungs, livers, adrenal glands, and bones are affected. Bone metastases are osteolytics. As I said before, bone pain can appear in case of appearing metastasis, so that's why osteoclasts destruct the substance of the bone, so movements are painful and people can detect it by themselves. So here you can see a scheme of movement of metastasis in organism, increased and enhanced angiogenesis because of increased amount of such proteins like that control angiogenesis. Here you can see a cluster of draining lymph nodes. They are swollen because of them and enlarged. This statistic scheme says us how many percentage of metastases are commonly spread in different organs. Firstly, it's lungs, lymph nodes, also bones and brain can be affected, and damaged, of course. The next one is G, histopathological differentiation, gradation. Here you can see kidney with infection and tumor. This is enlarged one. You can compare with a scalpel about 15 centimeters enlarged. With normal position it's 11 centimeters. Tumor is not very large but present. Here you can see again the differentiation of staging according to the size and appearing the movement of metastases to organs and structures. Here you can see gradation from JX to G4, and G4 is one of the most difficult for treating. It's undifferentiated tumor because we don't know what tissue from what tissue tumor grows, and it's makes the treating more difficult. And you should know about WILLMS'S tumor, nephroblastoma, typically in children but rarely appears in adults. Here you can see histological picture of this one, but this case is highly responsible to treatment, and about 9 from 10 children can be being cured. Pathologically, it's a triphasic nephroblastoma, comprises 3 elements: blastema, mesenchyme, and epithelium. These structures can be affected. Stroma may include striated muscle, cartilage, bone, fat tissue, and fibrous tissue, but don't means that it's not a dermoid cyst. It's a commonly spread nephroblastoma. Dysfunction is caused when the tumor compresses the normal kidney parenchyma. Here you can see a hilum of the renal part, and nephroblastoma as much as can compress all normal parenchyma. You can see the thin lining, but it's not normal situation. This is a difficult part for you maybe, but it's important to remember about molecular biology, not only clinic and histological part. Syndromes can be different, which are accompanied with nephroblastoma. Firstly, it's WAGR syndrome. It causes appearing the WILLM'S tumor, aniridia, genital abnormalities, and retardation. Associated genetic variant is because of gene deletion that includes both WT1 and PAX6. The risk is from 45 to 60%, and here you can see a description. Dennis-Drash syndrome, DDS, it's effect on the WTA to WT1 gene, exon 8 and 9. Risk is well high. Kidney diseases can appear since birth and leading to early onset of kidney failure. Also, genitalia can be ambiguous, and it's called intersex disorders. The next one is Beck with Wiedemann syndrome, BWS. Abnormal regulation of chromosome 11, this part 15.5, and the risk is 7%. But you should know about this syndrome for reaching our knowings. Different tumors, also WILLM'S tumor, macrosomia, so this patient commonly baby can have large burst size, macroglycia, hypertrophy. Also, it's omphalocele when the person's internal organ are opened and they are outside the organism in something like a sac or a seal. Visceromegaly, so these organs are enlarged. Diagnostic is one of the most important ones. all clinical methods. As you know, questioning survey, palpation, auscultation, and percutation, of course. It's maybe Pasternatsky syndrome, which can occur not only in urolithiasis but in high-risk tumor situation. And laboratory methods, general and biochemical analysis of blood, urine analysis, dipstick test, etc. Here you can see hematuria caused by damage in the parenchyma of kidney, and here you can see, well, yellow urine. Also you can detect hemoglobin and ESR, creatinine, alkaline phosphatase, and serum calcium. Alkaline phosphatase is very important because of its role in destruction stones, as I said, destruction of the bones. And as I said before, osteolytic metastases, they can cause the destruction of bones, and this substance is pretty much well detected in such cases. And calcium, of course, due to state of hypercalcemia. Diagnostic also can include intravenous urography, magnetic resonance tomography, MRI, also X-ray, CT, scanning bones for detection of metastasis, angiography, and positron emission tomography, and of course biopsy to detect the histological graduation of this tumor. Here you can see the upper part kidney tumor, maybe it's 5 or 6 centimeters in diameter under the liver, so it should be treated, of course, and the ways of it are resection or nephrectomy if this kidney is functionable, so it's only resection of upper part. People can live without some parts of their organs normally, so should remember about that. Here you can see some pictures. It's an incision of a tumor, a non-homogeneous structure, heterogeneous, and such organs are non-affected, so we can say that this tumor is lined by parenchyma and can be treated well. Here you can see also upper part kidney tumor too, but here we can suppose that one lymph node is enlarged, so biopsy is needed. We can see heterogeneous structure of the presence of this neoplasia, so treatment is needed. Here you can see also a tumor of kidney, but we can't detect is it middle or lower part of kidney. But we should know that it's a right side kidney because of presence liver on the CT film. Here you can see very large kidney tumor of the left side because liver is here, but we can see here tumor more than 7 centimeters approximately, maybe it's a T4, so it's dangerous to live with such tumor, maybe nephrectomy is prescribed. Here you can see CT sections, and here you can see large tumor in section under the liver. Maybe problems with liver too are accompanied, so I suppose this kidney is non-functionable, so maybe nephrectomy is prescribed. Here you can see polycystic disease and tumors in kidney, also cysts in liver. Here you can see tumor too. Here is a normal parenchyma and the tumor. There is a probably homogeneous structure. Here you can see ultrasonography. It's a normal kidney parenchyma, it's a normal stroma, and this large mass, about 7 or 8 centimeters approximately, maybe even more, it's a tumor, heterogeneous structure, because we can see brighter or darker structure, so let's treat it better. Here is kidney tumor too, but this is more susceptible, functionable parenchyma of kidney and stroma, but this tumor is very large too, as heterogeneous, even with cavernous of destruction may cause bleeding during the operation, so this kidney should be treated or resected or nephrectomy. Here you can see less tumors in size, about 4 centimeters, about 3 centimeters, and this kidney has its function, it may be resected. There is a kidney tumor too in the lower part of right kidney, in the upper part of left kidney. Here you can see the kidney tumor of down part, lower part, about 7 or 8 centimeters, and it's a right kidney because of present liver in the CT or X-ray film. Here you can see large tumor which even moves liver up to or back to, and it should be treated immediately. The next one part of our lecture is therapy, of course. Radiation therapy. Kidney cancer is resistant to radiation and chemotherapy in most of the cases, but radiation therapy is used to reduce the intensity of pain. If person has a large tumor, has many complications and side effects, so radiation can help. In the presence of bone or abdominal metastasis too, as well as in the case of brain metastasis. Chemotherapy, the overall effectiveness is about 6% due to the phenomenon of MDR resistance associated with the corresponding gene. You can see some drugs which can help person with this disease, actively exploring the possibility of chemotherapy in combination with the inhibitors of this phenomenon. Such drugs as verapamil and derivatives of cyclosporine are commonly used. Methotrexate, mercaptopurinum, rezovinum, or vinblastine are used too. Here you can see the concentration and dosage of these drugs for treating tumors in urinary tract. Here you can see their pictures. Immunotherapy is well used too, but is very expensive because it's immune drugs. Products, and its interferon alpha is used to activate B and T cells and macrophages. The most widespread use a combination of interleukin-2 and interferon alpha. The combined action is more commonly used and effective. Direct anti-tumor activity of interferon is from 12 to 15%. Not very much, but who knows what will help this patient, because everything is individual according to the immune state of person and other things, other factors. Here you can see the mechanism of immunity. Targeted therapy is more expensive, even more than immunotherapy, because it affects target points such as vascular endothelial growth factor, VEGF. This protein is about angiogenesis, so more vessels tumor has more risk, and more risk of this growth is present. mTOR protein is about proliferation of cells, of tumor cells. So this targeted therapy is for decreasing the movement and growth of the cells and their blood supply. In cancer therapy are used the following drugs. There are some groups. Inhibitors of VEGF receptors. It may be sorafenib, sunitinib. They include the action at RAF kinase inhibitors and tyrosine kinase inhibitors. The next one group, remember about them, inhibitors of protein. Here is receptors and protein VEGF. It's a bevacizumab, monoclonal antibody to this protein. mTOR inhibitors, it's a everolimus. And antibodies to tumor necrosis factors is infliximab. Difficult to remember them, difficult to know about them, but they are so effective, and targeted therapy is a future for treating tumors. Surgical treatment, as I said before, is needed. It may be resection, it may be nephrectomy. Surgical removal of the tumor is the most effective method of cancer treatment, because we can't say that living with the tumor is good and has not even side effects. Removal of the primary tumor increases the survival rate for all stages of the disease. The best results are at the primary stages of tumor. Here you can see laparoscopic variant of removal of the kidney with hand assistant. Surgical treatment also includes resection of the kidney. Resection is used for tumor class from T1, is available for resection if the diameter doesn't exceed 5 cm. Preservation of the functioning parenchyma can improve the patient quality of life. So remember, don't remove kidney if we can resect it, resect tumor. Here you can see the mechanism of resection of open operation, and also it may be provided laparoscopic. Technique of radiography is listed here. Radical nephrectomy is used in cases of non-functional kidney, big tumors, more than 7, 8, or even more than 10 centimeters. Here you can see a suture after operation on the left side. Postulates of oncology says that ablation is important, a minimal invasiveness and the availability of the object operation. Doctors should remember that metastases shouldn't be outflowing during the operation. Using the transperitoneal and transthoracic operational accesses to the kidney are available. Laparoscopic surgery is the most modern way of treating tumors. Laparoscopic surgery involves to use the laparoscope, special wand-like camera that is passed through the series of small incision or ports in the abdominal wall under general anesthesia. Here you can see some incisions and hand assistant incision. The advantages of laparoscopic surgery include shorter recovery time, shorter hospital stay, smaller incisions, fewer postoperative complications. And you should know that laparoscopic nephrectomy takes special skills to perform it and is not available at all hospitals, so only in a few clinics you can provide these operations. Stages of nephrectomy. They are listed at the next slides, but you should know about risks. It may be infections, bleeding during the operation, postoperative pneumonia, allergic reactions to anesthesia, or even lethal result. The first stage was described firstly. This is the second stage of operation. It's a clipping of vessels, and the third stage, it's a cutting, incision of this vessel to remove a kidney. Fourth stage and fifth one, when kidney is removed. You should know that firstly you can incise arteria, the next veins, and the ureter is the last one. Clinical looking after patient. The patient who have tumors are onco patient. First year, these people should check their state one time due to 3 months. Secondary years, one time in 6 months. And the next years, when their condition is normal, one time a year. because we can have some complications only in several years. General and biochemical blood analysis should be provided, urine test, ultrasound examination, and MRI of the chest. So, bene diagnostic or bene curator. The next one is ureter cancer. We move lower of the urinary tract. Here you can see some cases of tumor. It's being shaped like a tumor of the ureter. Here you can see small kidney. It may be a tumor of a baby or child, and it can be removed. Here you can see tumor of the ureter in the distal part of the ureter near to ureterovesical junction. Here you can see obstruction of the ureter due to neoplasia. Treating. It may be a radical open or laparoscopic operation. The modern one is Da Vinci nephrectomy, when a tumor goes from kidney to ureter. It may be such cases, and these procedures lead to removal of a malignant tumor. Adjuvant chemotherapy, also plastic surgery. It may be provided ureteroneostomia. So, if the tumor is located near to bladder, we can cut this region of the ureter and fix the upper part without tumor to the bladder. So we can make new opening from ureter to a bladder. Remember about that. And nephrectomy, of course, when we need to relieve pain and symptoms of obstruction by tumor. So the urine goes not to a bladder but to outside. The next one is bladder cancer, well commonly spread. From 11.5 to 12.0 per 100,000 people have this problem. So men get sick more often than women. Here you can see these points. The peak incidence is in the age group from 65 to 75 years. But you should remember that we can have in other cases according to impact of industrial hazards, smoking, chronic cystitis, so heredity and aniline dyes production. There are some people who have these diseases in their family very often, very commonly, for example, father and son or mother and daughter. So you can see different grades of this tumor according to its localization of the wall in the bladder. And classification, of course. T primary tumor, as you remember, from T0 to T4, but we can see new point is T in situ, carcinoma in situ. That means that tumor doesn't move over the basal membrane of the cell. And T1 to T4 according to extending to the structures of the wall, from subepithelial tissue to different organs around the bladder. Here you can see the structural wall and the size and the penetrating the structures and anatomical organs. Early symptoms include blood in the urine, hematuria, frequent urination, painful urination, and back or pelvic pain. So we can see that urolithiasis also can have these symptoms, but we can differentiate it due to diagnostics and well-known processes which can be in human organism. And regional lymph nodes from N0 to N3 according to the size of and presence the metastasis. Metastasis can be more than 5 centimeters, also in inguinal region of human organism. Here you can see the net of different metastases. This is their names, and they can be large and palpable for doctor. Here you can see invasiveness of tumor to the muscles or other structures, and some markers in diagnostic. Maybe cyturia, hematuria, presence of organic matrix, and extracellular vesicles. Distant metastases from M6 to M1, present or not present, or not or can't be evaluated. Here you can see a large net of lymph vessels and nodes, and they can be affected. For example, swollen lymph nodes of the armpit in women. G, histopathological gradation from G1 to G4, and as I said before, undifferentiated tumors are the most dangerous for diagnostic and treating. Here you can see gradation from stage 1 to stage 4 and their characteristics from T and M. Remember about that. It will be better for you to know all of these characteristics to be better in making diagnosis. Bladder cancers, and the main aim is know the symptoms and know your risk. Everybody can detect some abnormalities in their lifestyle, and some problems can be shown as a signs of the diseases. So it's a reason to have a visit for a doctor and check your health. The risk of bladder cancer may be increased with such listed scenes. Also, we said about them before. General facts: anamorphology. It may be different kinds of tumors. Carcinoma papillary one looks like cauliflower. Remember, 3–5% squamous cell carcinoma looks like plug, and 2% are adenocarcinoma, looks like ulcer. Precancer, this states you can see below. Bladder cancer can be diagnosed by such methods and procedures like CT, MRI, X-ray, urography, cystoscopy, and uroflow matrix. You should use them to and investigate this disease. Prognoses can be different according to the nature and pathogenesis of tumors. The most common metastases are in obturator, external iliac, and paravesical lymphatic surfaces in lymph nodes, so you can palpate them in the inguinal area. Long-term metastases occur in 50% of patients. Also, they can be osteolytic, and the most commonly affected organs are liver, lungs, bones, and adrenal glands. Here you can see the percentage of different stages in population. Surgical treatment. It may include transurethral electrocoagulation, TUE, transurethral resection of this tumor, removal of bladder at all if the tumor is large and bladder can't be functionable, and plastic operation. Doctors make new bladder, and operation is neobladder. Side effects of such surgical treatment may be different too. It's longer healing time, infections, mild bleeding and discomfort after surgery, inability to urinate, erectile dysfunction in men, or often after cystectomy. Also, operation can be open or laparoscopic. Here you can see removal of this tumor by surgical loop, and here is a scar tissue. Here you can see a next stage after operation if the person lives without a bladder. It's drainage tubes and collection bags, and here you can see a catheter. And here you can see some brief information about orthotopic neobladders. If a bladder is removed, so doctors can make a new one from the intestines, from loops of lower intestine. Here you can see the stages of this operation. If you want to know more, read about in different sources if you are interested in it. Radical cystectomy goes to neobladder. Here you can see we can have these loops, and there is a sac. Drugs. Medical treatment may be different. Firstly, smitamycin C, used for intramuscular chemotherapy, intravesicular BCG therapy or interferons. They induct a local immune response and cause activation of macrophages and T lymphocytes or cytokines. They are pulled into their bladder after operation. Systemic chemotherapy is for methotrexate, vinblastine, doxorubicin, and cisplatin usage after operation and during operation. And target therapy, as I said before in previous slides. Also, gemcitabine and carboplatin can be used, but side effects of such treatment can cause fatigue, infections, nausea, vomiting, hair loss, loss of appetite, and diarrhea. Here you can see the mechanism of usage BCG if patient has a bladder cancer. This complicated scheme of action BCG to their bladder tumors and how it activates our patient's immunity and leads to treating this state. Prostate tumors are well common in men, so we should know more about them. They can be benign and malignant. Benign ones are epithelial and non-epithelial, also can be mixed. Here you can see a histological structure and a scheme of appearing of these tumors. They can be like small nodes of soft consistency and other shapes. Here you can see classification of non-epithelial and mixed tumors. You should know about them something. And process of appearing tumor or hyperplasia. Firstly, the next stage is benign or malignant tumor. BPH, benign prostatic hyperplasia, is the most common neurological disease observed in men at age about 50, and hormonal changes according to pituitary gland changes and damages which secrete more gonadotropin. Enlarged prostate is observed. Pathogenesis, this tumor grows from the urethral glands and forms so-called surgical capsule of the adenoma. Signs and symptoms should be known, such as cystitis, impaired outflow, nocturia, and other one. Rectal investigation should be provided. Classification 1A, B, according to their impairing urodynamics. Check your attention on it. And 2A, there is a residual urine in the bladder, but muscular system is impaired. 2B, it's a moderate renal insufficiency is present according to their damaging of kidney. 2C, decompression of the processes and renal dysfunction is present. And the third stage is a complete chronic urinary retention, paradoxical uria, and severe kidney failure. So the third stage is most difficult and dangerous for person. Surgical treatment may include epicystostomy, imposition of suprapubic fistula, transurethral resection of BPH, prostatectomy if this process is well difficult, and cryodestruction. Risks are listed in the most damaged and dangerous are thromboembolia of pulmonary artery and stenosis of urethra. Here you can see the mechanism of removal of this neoplasia. And you should remember that 12% of malignancies in men is prostate cancer. Signs and symptoms: most commonly residual urine in bladder, crotch pressure can be felt in organs of perineal area, and frequent urination. Diagnostic may include rectal examination, X-ray typically, CT, MRI, uroflowmetria, and of course you should remember and know about PSA, the most important one. The normal rate is from 0 to 0.9 nanograms a milliliter, but if men have 40 years old, normal PSA is less than 2.5, and for 50 years less than 3.4. More points, more risk for tumor of the prostate. And here you can see some statistics and brief information about PSA test from Cancer Research of the United Kingdom. Classification, of course, according to the size and occupy of this tumor from T0 to T4. The T4 is the most dangerous one. Tumor germinates surrounding tissues and organs, for example, intestines or bladder. Metastases also can be present, and lymph nodes are swollen and enlarged. Complication may be multi-central growth. In low differentiated cancer, prognosis is very poor, and also it may be lethal results, abscess, fournier, cystopilonephritis, and other ones. So surgical treatment is well common in such cases too. Treatment may be different according to the stage, from radical prostatectomy to castration, estrogen therapy, and radiation or chemotherapy. So, well diagnosed can lead to well treated. Radical prostatectomy can be provided, so you can see a bladder without prostate. Also can be open or laparoscopic, and the next one and the last one is urethral cancer, maybe in different locations in men and women. Here you can see, but symptoms are different from bleeding to pain and inability to pass urine. Treatment may be open excision, laser, or penectomy in men. Also can be used such drugs. Penile cancer, it's not very commonly spread, but you should know about that. Localization is different according to the depth of their localization. These such factors can be risky for men, and symptoms may be different. Here you can see some pictures and histological pictures of this disease. Preventing is more simple than we think, and checking your doctor should be present and often for everyone. So healthy lifestyle and kind and polite attention to your health can be treated and well sign for your life. So be healthy, good luck, and don't have such problems with urinary tract.